Nursing builds really on a science base. Caring is very important, but you have to understand what's happening to the body.
Without question, our faculty, with the research they're doing and what they're sharing with students, is truly on the cutting edge.
You're not getting the textbook, which was maybe published 2-3 years ago. You're getting firsthand knowledge and research.
We boast, and I think we're quite proud of the fact that we have the most diverse student body of any university in New England.
One of the things that I just love about UMass Boston, people here really care about people, and what we're all about here is making a difference in people's lives.
I always felt a need in this area for a publicly supported baccalaureate program. And Ann Hargraves, with whom I had worked for 12 years at Boston University, and I had often talked about the fact that there should be a publicly supported program. We were both really committed to wanting good, solid education for these kids. So that was really our motivation and why we got started. It was because of belief in the value of education, knowing how it opened up opportunities for us, and we wanted to make the same thing available for other students, and knowing that we would be doing a service to the city in providing a good, well-prepared individual who could provide service to hospitals and to the community.
I wanted to be at a place that mattered. And it can be viewed as trite in today's world that education can be transforming. But with the inspiring minds and inspiring lives that exist on our campus, it's very easy to see that incorporation and inculcation of knowledge and that commitment and seriousness of purpose, which is essential, particularly in the areas of nursing and health science, that makes our institution so great. We have one of America's most terrific leaders of nursing, science, practice, and caring in Dean Glazer. One cannot help but be impressed by the passion that she and her colleagues bring to the exercise of educating tomorrow's healthcare professional.
The very first thing that we have to be interested in is the student learning experience. We have to care about the students and that they get the best possible experience that they can. It's a collaboration. We work together to try to figure out what it is the student needs, what it is we have to offer, and how can we work together so that everyone gets the best education.
I think a nurse plays a very important part in a person's health. A patient loves to rely on a nurse that cares. Patience, knowledge, little humor, and personality. The personality, I think, is very important. It's not all business.
We want every student, every nurse to have a safe practice. That's necessary, but it's not sufficient. I want them to be critical thinkers. I want them to be able to think outside of the box. I want them to be able to think on their feet. I want them to be able to expand beyond the individual. Whatever their situation is, I want them to be able to see that person and who that person is, so that they can then bring the best care to whatever the situation is.
You really need to have a strong knowledge background to be able to sit at the table with other professionals that you work with. I think to be able to have a strong background and be able to participate in discussions and patient care at the same level is important.
We have quite a broad spectrum of programs, actually. We have the basic baccalaureate program and a totally online RN to BS program. Then we have different master's degree tracks. And we also have a PhD in nursing with a health policy focus. And there are very few schools that have a health policy focus nationally.
We don't have enough doctoral programs in the state of Massachusetts. I believe there's only 3, and it's the only one that has a focus on health policy for nurses, which is an extremely important part of building not only policy people, but administrators, educators, and researchers. I start with this college before it was a college. I was involved in that early development and still am involved because I believe that they're doing something that's very important and very good.
An exercise science professional definitely has to be educated in all elements of physical fitness, and I feel like a lot of trainers in the industry don't really listen to exactly what clients need and don't cater programs to them. So I feel like an exercise professional definitely needs to be a great listener. I think that those are very key elements that I've taken from UMass, not only have learned in the classroom, but on my work site.
I get exposed to a lot of different universities and programs in exercise and health sciences. And one of the things that I always take back after talking with colleagues is really how well positioned we are at UMass Boston and the many great things that we have going for ourselves here. The uniqueness of our program starts with our faculty. It also starts with our students themselves. And having, again, the opportunity to interact with a lot of different students, I'm really always highly impressed and inspired by our own students and how motivated they are to actually get the very best that they can from our program.
There are 3 concentrations. One is exercise science, the traditional exercise science physiology. The next one is health sciences, and that one is to prepare people that are interested in any one of the health professions. So they come here thinking that they may want to be a physical therapist, occupational therapist. So health science is a new option. And then we have people that are interested in managing programs for people that address their health and wellness needs. That program now is collaboration with the College of Management, so that they'll get the management skills and the exercise science.
Prevention really is the best medicine, and our department is really focused on promoting health across the lifespan and using lifestyle approaches to promote health, physical fitness, healthy eating, and other lifestyle habits that lead to improved both quantity and quality of life.
I feel like I don't just offer the components of fitness or health of a background. I offer also a lifestyle change, and I like to see that lifestyle change in others. With the education and the information that I provide, I hope that people use what I give them and mold it into something that they can continue in their own life.
There's been tremendous collaboration between the exercise and health science department and the nursing department. And so we're very committed to interdisciplinary education and interdisciplinary research. So it starts between our departments and then it extends out into the community.
University of Massachusetts Boston is partnered with some of the finest healthcare institutions that exist anywhere in the world. You're kind of known by the company you keep, and undertaking a nursing education, understanding exercise physiology, blending those together in the healthcare capital of the world is a unique opportunity for students.
I think we're able to provide students with a number of experiences, particularly in not only the academic teaching centers, of which we're a part of here in Boston, but also in the community health centers. I mean, we live in an area that's really rich with medical care, medical education, so our students really have the benefit of being given access to that.
One of the things we look for is that the faculty are willing to partner with us in a way that will ensure the best experience for the nursing students and, more importantly, our patients and families. UMass Boston provides an education that allows students to come out into these high-intensity academic and community environments and hit the ground running.
All my years of training, as well as my years of professional practice, I've had the great fortune to work with University of Massachusetts nurses at every level. And I can tell you that the doctors are great at saying things, the nurses are great at doing things, and the University of Massachusetts nurses would stand with graduates of any institution in terms of capability, competence, compassion, and just to take charge, go-to people that doctors have grown to depend on.
We are very not only satisfied, but very pleased with what the students who come from UMass Boston, with the faculty who support them so well in our setting, bring to our patients and families and staff.
They've always been the nursing leaders in whatever hospital setting I've practiced at, and clearly have been recognized as the same by my colleagues. They've distinguished themselves in the healthcare arena.
I did a lot of research trying to find, the best school for me, the best fit, the most diverse, one with a really good reputation. The thing that really solidified coming to UMass Boston was the stuff that you can't see on paper. I came here, I talked to the dean, I talked to the faculty, I talked to students before I started in the program, and I did that at 3 or 4 of the other schools that I was accepted into. And once I did that, there was no decision to make. It was UMass Boston. So
I feel enthusiasm, like you read about, a genuine expectation of greatness.
With the faculty that I've had, with the curriculum, I feel strongly that they really prepared me to be a great nurse practitioner when I finished school.
The reason why I chose UMass compared to some of the other nursing programs was because the diversity, the location, the high standard of learning, the fact that they are a community-based nursing school, so not only do they teach us about going into the hospital setting and working with the patients, but also going out into the community.
The first class I had sold me. It was challenging, it was stimulating, it was just fabulous, and I went home every day with a smile, and I've been pretty much doing that ever since.
It's the people, and it's the students, and it's the diversity, and it's the opportunity to help people to realize their dreams and their goals.
To be able to say that we're partnering in such a significant way with UMass Boston makes me very proud as the chief nurse.
It's exactly what this city and this Commonwealth need in exactly the right location with exactly the right leadership.
What makes a great education? Great faculty, great students, great clinical agencies, the ability to see how research, community outreach, and teaching all interrelate. And I guess I would say an enthusiasm for the mission, and what we're all about here is making a difference in people's lives.